Good evening, everyone, here and all over the world. It's my pleasure to be with you today discussing laser use in dentistry. I would like first to thank everyone who gave us the chance to be with you today. Arab Medical Systems, Medency, and of course MEDLINK. It's really my very pleasure to be with you today and share a little information about laser, which is my passion. My name is Dr. Amr Rafat. I am a fellowship holder from Genoa University in laser dentistry. To start with today, we are going to talk about laser use in dentistry, and actually to make things a lot easier, we have classified our webinar into two categories. The first one, we will talk about the basic science of laser. This will make us understand how laser works, how can we generate laser, what is laser, and the most important tips and tricks for laser use. The second part will be with Dr. Yusra Pastawisi. She will share her knowledge about soft tissue applications for diode laser and tips and tricks in clinical use of diode laser. And the most important question we need to understand after this webinar, whether should we buy diode laser at our clinics? What is the difference between the conventional work and the laser work? To start with, I will start with the part of laser physics. It's the core concept of laser. We need to understand how laser works in order to operate with laser in our clinics. Today we are talking mainly with Medency diode laser. They have Primo laser. It's one of the top, and we will discuss its benefits and advantages in the laser technology. Please, we should note that in our use of laser, we should know what is laser, what's the nature of laser, how can we use laser in our practice, and the most important thing, why should we abandon our conventional or help our conventional methods with laser-assisted technology? And for me, I will try to explore with you how can laser help us in our clinics. To start with laser, we have to understand the laser physics. Laser is abbreviation for light amplification by stimulated emission. What we need to understand from this word is that laser is basically light. It's like any light in the world, but with specific specifications, and generated by a specific concept called stimulated emission. We don't want to go deeply through this concept, but what we need to know is that laser is originally a light. Since we said that laser is originally light, we need to differentiate between laser and ordinary light. First of all, we have three concepts for light. In our traditional studies during our school, we know that light has multi-chromatic waves, which means multicolors. We can see green, we can see blue, we can see red, we can see whatever color we can see in ordinary light. But according to the laser, we managed to have a monochromatic light, which is one color light. We have single color in this light. This gives us the following specifications: the directionality, the ordinary light. If we turn on any light in our room, you can see the light spread in your room. But if you use laser, you can see laser go in a specific direction to a point. This specification of laser helps us a lot to use in our laser treatment in dental clinic, and gives us the third specification, which is coherency or coherent. Coherent means that we have single color with one direction and one wavelength. We know that any color or any light is consisted of something called waves. This wave has a bottom and end. The distance between the bottom and end, it's called wavelength. Since we have one color, we have one direction, and we have one wavelength, which is coherent. Coherent means it goes regular in the same wavelength. So how can we generate a light with the specifications of laser that we said before in the slide before? We have, our scientists have invented something called the laser system. This laser system composed of three main components. The first one is the active medium, which can be solid or gas or semiconductor or liquid. The second component is the excitation mechanism, or for me, I call it the power source. It's maybe electrical, more optical or chemical. Or the third one is something called optical resonator, or simply two mirrors. What happens deep inside, and I don't want to bother you with this complicated info, that the energy or the power source we have works on the active medium we have and tries to excite the electrons of this active medium. Once the electrons have an excitation or have energy, it goes from their energy levels to another high energy levels. This makes the electrons not stable or irregular, and electrons need to be regular or stable. So it comes back again to the original energy level, but when it comes back, it must lose the energy it gains. So this energy lost as laser beam. After a certain amount of energy, the laser beam started to go through the mirrors we have in the laser component. I'm trying to simplify this component. It's much complicated than that, but I'm trying to tell it in a simple way. After we get our laser, we studied this light that generated from our system, and we discovered that laser has a wavelength in an area called infrared or near infrared area. Anything in the world or in our lives, such as X-rays, any light or any rays we use in our ordinary life, it's called electromagnetic spectrum. It has a certain wavelength and it has a certain specifications. Some of the waves can be seen, such as any light we can see, the sunlight we can see. This part that our eyes can see is called visible light, and it ranges from 400 nanometer to 700 nanometer. Anything else, such as increasing or decreasing from the visible light range, our eyes can't see. So what we can say from this slide, that laser is a non-visible light. Our eyes can't see the laser because it has a wavelength beyond the range of the visible light. Of course, we have some lasers such as KTP and diagonal can be seen as it is from the visible light range. But what we have to understand here is that every laser has its wavelength, and every wavelength has its specifications, and not all the lasers can be seen through our eyes. So we generated the laser and our laser device. It's time to deliver it to the tissue. Actually, the companies have worked a lot to invent a very simple way to go through this delivery systems in order to make it easier for us to operate our work. After the laser have generated in our device, we have something called fiber optic wire. This fiber optic simply consists of silica, and silica is the main particle of glass. Simply it's glass, but in the shape of wire. The laser goes through this wire and travels until it reaches our handpiece, which we hold in our hand. This handpiece comes with a disposable tip. What does it mean, disposable tip? In the third image, we can see this metal covered tip that is in contact or non-contact with the tissue. This tip comes with three diameters, main diameters, something called 200 micrometers, which is the smallest, 300 micrometers, the medium sized, and 300 and 400 micrometers, which is the largest in diameter. Why do we have the three sizes? What can we benefit from it? Simple equation: as we go larger in diameter, we lose some flexibility, and we also have much energy from this tip. Let us make it simple. If we have a laser operating at 1 watt and we are using a small tip, the power that comes from this tip goes further or long distance rather than if we have a large tip. I will discuss it in a later slide, but what I need to know, you to know that we have three tips. Every tip has its use and every tip has its advantages and disadvantages. After we deliver the laser to the tissue, it's time to know what laser can do to the tissue, why laser is effective for the tissue. If you study any light in the world, you can see four main things the light can do for any surface or any tissue it hits. First, laser can be reflected or refracted. Reflected means if you hit the laser, it comes back in the other direction. Scattered, the same, it doesn't go through, it diffuses in much directions. Absorbed and transmitted. What we really take care of, that our laser should be absorbed in the tissue. Once our laser is absorbed in the tissue, we will notice a big difference to this tissue. We will study the difference that happened in the tissue by absorption, but what we need to know that the laser should be absorbed. Anything else will happen to the laser will not benefit us very much as the absorption. Here's a diagram with the four main categories that happens when laser strikes a tissue. We see the transmission, the absorption, scattering, and the reflection. And as we said, the most important thing is the absorption. We have a big question now. How can we make sure that this laser is absorbed? Well, we have a solution for this. By the studies, we discovered that every laser has a partner that likes to be absorbed in. In another way, we have something called chromophore, or a target in every tissue. Let's talk in a simple way. Every laser, when it hits the tissue, it searches for the best component that will be attached to. For some lasers, the best component is melanin hemoglobin. For other lasers, it's the water and hydroxyapatite. And this makes us discover that we have lasers that be used in soft tissue and laser to be used in hard tissue, according to the affinity of laser that will be combined with the chromophore. Since then, let's revise what we have said. The laser comes out of the device with a specific wavelength. It's like the DNA for the laser, this wavelength. Every laser has affinity, or every wavelength has affinity to specific particle in the tissue called chromophore. If we have this particle, the laser will be absorbed and we have our effect. If we don't have it, it will be useless or doesn't make any the effect we want. For our laser, the primo one, it's called diode. This naming comes from the active medium in its component, and it's called diode. That's how we name our lasers. The diode laser has an active medium of diode, and this laser operates in the soft tissue. Why does it operate in the soft tissue? As we said, it has a chromophore. When we use diode, it likes, we can say likes, to combine with any melanin in the tissue, any hemoglobin, and barely water and protein. This specification of diode makes us use it at the soft tissue area in our mouth, such as gingiva, such as anything related to frenum, or as we will see with Dr. Yusra, the applications. That's how we classify our laser. The soft tissue lasers, which has a target or chromophore for soft tissue, and the dental hard tissue. A simple note for dental hard tissue lasers, that dental hard tissue laser works best with water and hydroxyapatite. Every single cell in our body contains water. That makes the dental hard tissue works for soft tissue and hard tissue. And this is one note to understand. But our diode laser works for the soft tissue. After the laser is absorbed in our tissue, we have to note what happens after absorption. This is a big question, and we need to concentrate in this issue to understand how laser works exactly. We have four main effects can happen by laser after its absorption. The first one, photothermal, and this means that the laser is absorbed and converted into thermal power or thermal energy, which will cause either incision or excision or ablation or vaporization. I will discuss this with you in the later slides. The second effect which can happen is something called photochemical. The laser stimulates a chemical reaction, such as we have composite curing with specific types of laser or specific types of light. The third effect, fluorescence. This is very much used in occlusal surface caries detection, such as in diagonal dent. And the fourth effect is biostimulation, and this category has a majority use with laser, as it increases the growth factors, relieves pain, increases the wound healing. This we will see with Dr. Yusra. What we are most concerned about is the photothermal effect. This is how we do our incision, and this is how we do our surgery. Is the sound okay? Because someone says there is no sound. I hope it's okay. Let's go back to. Let's go back for our tissue temperature and the photothermal effect. Let's arrange our thoughts. The laser is absorbed in the tissue according to the chromophore, and we have now used the photothermal effect. The photothermal effect means that the laser is absorbed and it is converted into heat. This heat is very useful and can be very bad. So I have to understand that this saying. Our normal body is 37 Celsius temperature, and this is the normal of any cell temperature. Once the laser is absorbed in every cell, the heat is raised until it reaches the 60 Celsius. In this level, the protein content of the cell started to denaturate and coagulate. To to explain this coagulation and denaturation, we can say when you boil an egg or you put an egg on heat, you see the difference in the shape and the difference in the consistency and the difference in the color when it turns from the normal color of the egg to the white one and the hard one. This is the coagulation and protein denaturation. And in this level, we can coagulate the blood vessels, which will prevent bleeding. We can coagulate the nerve endings, which will prevent pain, and we can coagulate the lymph vessels, which will eliminate the edema. That's why we say that laser is working without bleeding, without pain, without edema, or any side effects. But what happens if we keep raising the temperature, if we keep using the laser and the temperature is raised? Once we reach 100 Celsius, the effect takes another effect, and the cells content started to vaporize and it started to disappear. In this level, the cells lose its cellular fluid, and this makes the laser in the incision mode. What does it mean, incision mode? The cutting mode. Once the cell is vaporized, we have the cutting effect working. If we raise the temperature more than 100 Celsius, we are facing something called carbonization. The only substance is left from this cell is the carbon. This is an indicator that we are beyond the limit of treatment. We are very safe when we coagulate and vaporize, but once we reach the carbonization level, we have to take a note and stop our treatment, or to adjust our parameters such as power or our hand speed. Carbonization is something we all hate, and we don't recommend in our treatment as a laser dentist, but it may happen. This is not that bad, but it delays the healing, and the healing quality is less with carbonized tissue. So we have to take care not to reach the carbonization. Carbonization also appears as a black color over the tissue we are working with. The companies have helped us to avoid carbonization by making a very good option in their devices, which is called emission modes. In any laser, as long as we are pressing the foot control for the laser device, the laser is coming out from the handpiece. But what we have done in the emission modes, we have done something called gated or pulsed mode. This mode makes our laser comes in shots or in small patches. But what's the main reason for that, or how can we do that? The main mechanical system that makes our laser comes in pulsed mode is a gate is put beyond the mirror we talked about. We have a small gate which closes and opens and makes our laser comes in chopped way or pulsed way. This gives the tissue something we call tissue relaxation time. As the laser works, that the laser delivers heat. Once the laser stops, the heat will reduce. This makes us avoid the carbonization and gives us a better treatment options for some cases, as we can discuss in the later slides. So to give you a keys for proper laser use, this is the main keys we can use when we use our laser. We know already the emission mode. If you use the continuous mode, the laser is going continuously, which may raise the temperature continuously and reach the carbonization. So if we face carbonization, we can use the pulsed mode. We will talk about the second key we can manipulate is the tip selection. As we discussed in the first slide, we have 3 tips we can select from the device, the 200 micrometer and the 300 micrometer and the 400 micrometer. And let me show you the difference. The smaller the diameter of the tip, the deep effect goes into the tissue. I mean, if we use small tip diameter, the depth of the power goes much more. But in case we used a larger tip diameter, the effect will be much superficial. And this can be very helpful in some cases, such as depigmentation. We don't want to reach very deep, and we want to treat the superficial layer. We can use the 300 micrometer or the 400 micrometer. The third key we have here is the tissue type, and this we discussed in the chromophore. We have to select our tissue and select our laser that suits this tissue. Let's say if I'm going to have a depigmentation or gingivectomy, the diode laser will be good and will be perfect because it works very good with the melanin cells or the hemoglobin cells, and it will be absorbed and it will have a good effect. But we can't use the diode laser in a tooth. This will make no effect. And if we used it with a high power or wrong parameters, we may cause some problems to the pulp, as it will go through the enamel, dentin, and go through to the pulp and raise the temperature of the pulp. So we have to use our laser with the tissue properly for this laser. The fourth trick that I use a lot, my hand speed. Let's assume that we are working both with the same power, and we are working with the same emission mode and with the same tip, and we are in the same tissue. If I'm working with a high speed hand, that means my hand moves very fast. I will not cause the same effect when we work with small speed hand. As the energy delivered by the fast is much less than the slow hand. We have to take consideration when we use laser that this trick is very important in some cases. Many cases have a pain threshold is different than another cases. We have to have the sense of this thing and apply the appropriate move in the appropriate tissue. The last key I have is the power selection. Every diode laser comes with a preset of power from the company. But the main question, is this power suitable for all the cases? I would say no. That's why I am discussing the nature of laser. We have to understand every case and study every case alone, and to use the power suitable for every case. We have a range can be operated in, and we can select according to every case. We have to check the tissue type, we have to check the pain threshold, we have to check everything should be checked. We talked about this. This is a diagram showing the same power but with different tip sizes, and we see here the diameter affects the depth of the power when it works with the tissue. After this understanding and brief about laser physics and how laser generated and how laser works with the tissue, we have to get a benefit and drawback of laser. For me, one of the most important benefits its capability of selective and precise interaction with diseased tissue. We can be very selective as the laser is used with the suitable chromophore, as we can use in melanin gingiva less than the healthy gingiva. It will strike the melanin gingiva much more. Laser has a very, very, very good effect in reducing the amount of bacteria in our surgical site. This benefit we can't take from other devices. It can be taken from laser, as it decontaminates the surgical site we are working in, as the laser have a very good affinity to kill the bacteria and to decontaminate the area. The good thing also, which I was facing in the conventional methods, that we used to have a bleeding site in many cases, and I used to refuse many cases due to this thing. But when we use laser and compare it to the conventional method, you will see the hemostatic effect and its benefit on your work. You can be working with a clear site, which gives you a much better treatment option for this site. For me, I would say one of the drawbacks is the high pricing of lasers. But recently, in the last 2 years, the laser is spreading very well, and the education of laser is spreading very well. And this makes the laser is very good device for the clinic, and worth the paying, as it has a new treatment modality for the patient, and the patient understands that this device makes a better treatment and can be affordable for him. One of the most important things we have to know and understand when we use laser, we have to be safe. Our patients and our assistants and the doctors must be safe from laser. Is laser safe? We can say it's safe unless you don't use the given precautions. The first thing, we have to protect our eyes. And for the simple equation, we can say laser likes to bind with melanin. Eyes contain melanin, and this thing we have to protect. The diode laser has a high affinity with melanin and combination with melanin, and the eyes have a good amount of melanin, and this should be protected. Why should we protect it, as we don't point our laser in the eyes? We have scattering rays when we use laser in the tissue. It can scatter in many directions, and one of the directions could be the eyes. Every laser has its specific googles, and this google comes from the device. It has a specific wavelength, works with the diode laser, and we should note that there is a writing on every google that says it suits the following wavelength. So the first thing is wearing eye googles for you, for the patient, and the dental assistant next to you. One of the most important things, and many don't consider, is the high suction or high volume suction. The problem when we use laser, we have something called plume. The plume is the vaporized tissue, and the smoke comes out from the diode laser. It's very little, but it can take virus or take bacterial infection through your respiratory inhaling. So the most important thing to use a good high suction. This will eliminate any plume comes from this treatment. The last thing we have in laser safety, and one of the most important things, and unfortunately we don't use a lot, or we don't take care of it a lot, we have to put sign for our clinic that it uses laser, in order not to suddenly have any accident or any doors open or something like that while we using laser. This sign should be put in every clinic that is operating with laser.